Hello and welcome. Today we're going to delve into a common, yet often silent, threat to vision: primary open-angle glaucoma, or POAG. So, what causes POAG? Unfortunately, the exact cause is still unknown, but it's believed to be a complex interplay of several factors. These can include genetics, as glaucoma tends to run in families. Other risk factors include increased age, high intraocular pressure, race with African Americans being at a higher risk, and certain medical conditions like diabetes and high blood pressure. While we can identify risk factors, it's important to remember that having these doesn't guarantee you'll develop POAG, and vice versa. To understand POAG, we need to understand the eye's drainage system. Aqueous humor, a clear fluid, is produced inside the eye and flows out through a drainage angle. In POAG, this angle remains open, but the drainage process becomes less efficient. This leads to a gradual build-up of pressure inside the eye, known as intraocular pressure or IOP. Over time, this elevated pressure damages the optic nerve, the vital cable that transmits visual information from the eye to the brain. The damage to the optic nerve results in progressive, irreversible vision loss. POAG is a significant public health concern, affecting millions worldwide. It's one of the leading causes of irreversible blindness globally. Its prevalence increases with age, and as mentioned before, certain populations, such as African Americans and those with a family history, face a higher risk. Because early POAG often has no noticeable symptoms, many individuals are unaware they have the disease until significant vision loss has already occurred. This is why regular eye exams are so crucial. Now, here's the tricky part about POAG. In its early stages, it's often asymptomatic. That means there are no noticeable signs or symptoms. As the disease progresses, individuals may start to experience a gradual loss of peripheral or side vision. Many people describe this as having tunnel vision. They may also notice difficulty seeing in dim light or trouble adjusting to different lighting conditions. Unfortunately, once vision loss occurs, it's usually permanent, making early detection and treatment so vital. Diagnosis of POAG involves a comprehensive eye exam. Your eye doctor will measure your intraocular pressure using a tonometer. They'll also examine your optic nerve for any signs of damage using an ophthalmoscope or other imaging technologies. Visual field testing is performed to assess your peripheral vision and identify any areas of vision loss. Gonioscopy is used to examine the drainage angle to ensure it is open. These tests taken together provide a clear picture of your eye health and help determine if you have POAG. POAG doesn't typically have classifications. The disease is generally treated the same way regardless of the severity of the pressure. The primary goal of POAG treatment is to lower intraocular pressure and prevent further damage to the optic nerve. This can be achieved through various methods. Eye drops are the most common initial treatment. These medications can either reduce the production of aqueous humor or increase its outflow from the eye. Laser therapy, such as selective laser trabeculoplasty or SLT, can improve the drainage of fluid from the eye. In some cases, surgery may be necessary to create a new drainage pathway for the fluid. The specific treatment approach will depend on the severity of the glaucoma and your individual needs. Unfortunately, there is no definitive way to prevent POAG from developing. However, early detection and treatment can significantly slow its progression and prevent vision loss. The best way to protect your vision is to have regular comprehensive eye exams, especially if you have risk factors like a family history of glaucoma, are over the age of 40, or of African American descent. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, may also contribute to overall eye health. While there's no cure for POAG, with early diagnosis and consistent treatment, most people can maintain useful vision for life. Recent research is focused on developing new and more effective treatments, including gene therapies and neuroprotective agents, that could potentially protect the optic nerve from further damage. Researchers are also exploring ways to identify individuals at high risk of developing glaucoma before any vision loss occurs, allowing for earlier intervention and better outcomes. The future of glaucoma treatment holds promise, and ongoing research offers hope for improved vision preservation.